This is the Cancer Interviews podcast. Welcome. I'm your host, Bruce Morton. We don't hear a whole lot about testicular cancer, but it's out there. On this episode, we'll hear from a man who was diagnosed with it, survived it, and these days is doing plenty to help others diagnosed with the disease. He is Mike Craycraft of Cincinnati, Ohio, and he has an informative story to tell regarding his past, present, and future. So here he is, Mike Craycraft. And Mike, welcome to Cancer Interviews.
Thank you. Thanks for having me.
We always start from the same place. We like to know a little bit more about our guest, exclusive of his or her life, his or her involvement with cancer. So if you would, Mike, tell us a bit about where you're from, what you do for a living, and when time allows for fun, what you do for fun.
Yeah, so I was born and raised in Cincinnati, lived down in South Florida a couple of different times. I'm a clinical pharmacist by trade, and most recently founded the Testicular Cancer Society as my full-time job. Outside of that, when I have downtime, I love to travel around the country and world following Jimmy Buffett. And anything outdoors.
And we'll talk about the Testicular Cancer Society a little bit farther down the line on this interview. But with respect to your cancer journey, unfortunately, every cancer journey has a starting point. And for you, what was it? When did you notice that something wasn't quite right?
Yeah, I was living down in South Florida in 2005, right after Hurricane Wilma, and with no AC and power, I just went to adjust myself sitting down on the couch and felt a ridge on one of my testicles. I immediately knew it was cancer, but it took me quite some time to actually get up the nerve to go to the doctor.
And how long did that take, and what triggered your going to the doctor?
Well, 7 months actually, which coming from a healthcare professional is pretty idiotic. I would feel the lump at night. I would get hot flashes and feel it. I wouldn't feel it in the shower. I didn't really have a primary care doctor except for one listed on insurance. And I kept saying, well, after this, I'll go, after Thanksgiving, after Christmas, after Dad's birthday, after this trip, that trip. Pretty much convinced myself that I was going to die from metastatic disease, and went so far as to actually come home and throw my own going away party that Thanksgiving without telling anyone why I was doing it.
And there must have come a time after that in which you did tell other people?
Yeah, I had kind of a final hurrah. I went surfing in Costa Rica Memorial Day weekend, and before I even left, I knew I'd been delaying and delaying, so I booked an appointment for 2 days after I returned, and so I had to. I figured, my parents paid my college tuition, and they would be pretty upset if I ended up just never going to the doctor and passing away from something. So that kind of was the impetus to finally say, okay, let's go, let's get this done and see where we're at.
And how difficult was it, when you think about the party that you threw and its reason for being, how difficult was that, trying to come to terms with the possibility of your mortality, of this perhaps being a fatal disease?
That part probably wasn't as difficult as much as staying quiet about it, believe it or not. So I grew up, I played club soccer and traveled around the country playing. I played Division I college soccer. I was a pharmacist at 22. I'd never been married, had no kids. No real responsibilities except for myself. And I looked at things as, not to sound like a martyr, but number wise, it has to happen to someone. And, I was kind of the perfect person to have it happen to. And I'd had a great life, was incredibly satisfied with the life that I had up to that, mainly because of the incredible people and friends and family I had. And so I really just couldn't find room to complain, as weird as that sounds. So I essentially made peace with passing away, and but was quite surprised when I found out that wasn't going to be the case. So,
by the way, if you like what you hear on this segment, we invite you to subscribe to our podcast by clicking the links below. Once there, you'll see a bell icon, and if you click on that, we will notify you when we post a new interview. So, Mike, I think the next step in this story is you said that you got good news when you went to the doctor, but explain in more detail what happened when you went to the doctor and what he or she told you.
Yeah, well, I finally decided to go to the primary care doctor, let him know what's happening. He ordered a scrotal ultrasound, went and had that done. He called back and didn't really want to say much, said, I'd like you to see the urologist. And so I made an appointment for a week later, and After hours that night, the urologist called and left a voicemail saying I could come in anytime I wanted the next day. So that was pretty much confirmed. He wasn't going to give me an award, but rather a cancer diagnosis. And so I went in. I had actually worked at a medical center with the urologist. He recognized my name and he said, "Don't worry, we're going to take the best care of you." And I had been living like I was dying. And so my response was, "Well, can I get any money back?" And he's like, "What?" I'm like, "Never mind. Okay, so what do we got to do now?"
Okay. And what had to be done?
Well, essentially, it was just, the preoperative tumor markers and CT scans to see if it had spread, and then scheduled an inguinal orchiectomy. They take the testicle out up through the groin area, kind of like a hernia surgery. And then from there, trying to figure out exactly what stage it is. Luckily, mine was still stage 1, miraculously. Waiting 7 months can be catastrophic. For some reason, I had a lazy growing cancer. So it kind of fit in with my laziness during those 7 months, too.
Mike, some of the people listening or watching are people who might be diagnosed with testicular cancer, or they just got diagnosed with testicular cancer. For those individuals, describe what that procedure, the one you just referenced, describe in more detail what that was like, what it felt like.
I mean, honestly, I had a pretty easy time with it. I had surgery on a Monday and found out that same evening that a friend of mine I'd been surfing with in Costa Rica had perforated his intestines and was in the ICU. So I ended up Wednesday going out and visiting him in the ICU, and even went out to happy hour just to let my friends know, hey, I made it. I wasn't moving quickly, but I was able to get around and hobble, and it hurt to laugh and cry and sneeze and cough, but it wasn't tremendously bad. Just kept ice on my groin for a week or so, and was back to normal pretty quickly.
Now, you had said that you'd pretty much come to terms with a worst case scenario, but now you've gotten the best case scenario. Were you rather calm in how you took that, or were you elated?
I was pretty elated. I think everyone, or vast majority of people, go through that. Okay, I'm going to live life to each day, and so I tried to do that even more. And yeah, I mean, I don't like being wrong, but in this case, I was so glad that I was completely wrong.
Now, while you had it, and in your procedures aftermath, what describe for a lot of us who don't know the answer to this question, although it may seem obvious to you, what does testicular cancer feel like? How does it impact you?
Yeah, I mean, physically, there's not much. I mean, only about 20% of the time is it even painful. So I actually went in for a second radiation oncologist appointment, for lack of a better term, opinion. And when I walked in and said, hey, I'm Mike Craycraft here to see Dr. Green, they paged him overhead. And I had to look at him like, I'm a patient, right? I was another otherwise healthy looking, nothing wrong 33-year-old. I just, I had cancer that, if not addressed, would be detrimental. I lucked out with stage 1, and I had the option of undergoing surveillance. So from then on out, it was just a matter of going for the proper CT scans and blood work and the whole scanxiety that goes along with that. But 16 years later, luckily, it has not returned. So
you referenced pain 20% of the time. What was that pain like?
Well, I didn't have any pain whatsoever, but just only about 20% of guys that have it actually have pain associated with it. It's usually a painless lump that's found on the testicle. You can have some swelling, or you can have a testicle decrease in size. Later on, you can have more like back pain, difficulty breathing, pain in the chest muscles. But really, otherwise, besides just a painless lump, there's not much to it. And they're not that big necessarily. It can be the size of a pea. So, it can be somewhat difficult to know what's going on. And I think that's why some guys get diagnosed late stage and don't even know it. They get in a car wreck and go get a CT scan, and, it reveals, oh my gosh, there's a tumor in your abdomen. And they found out that it came from the testicle.
A lot of this you described took place in the year 2006. As we talk today, it's the year 2022. If prior to your diagnosis, you could describe yourself as being 100%, In 2022, how close are you to being 100%?
I would say if I could, curve for the getting older part, I think pretty much 100%. So, 2013, my 7-year cancer anniversary, I summited Mount Kilimanjaro. It's been a little bit, broke a leg since then and a couple of ribs, but, otherwise, pretty much can do anything I want today that I wanted to do before my diagnosis.
Some people we speak to on this show think that there's something to be gained in some form or fashion from documenting their cancer journey. It can either be documenting the good days and bad days, or we had a guest who was a caregiver, and the caregiver documented everything that was said in the exam room when he accompanied his wife. Did it ever occur to you that there could be something to be gained from documenting your journey?
Yeah, certainly along the way. I have a pretty good memory and a medical background, so the appointments and things like that weren't necessary. For my 3-year cancer anniversary, I was asked to write my story in a chapter of a book. They wanted 5,000 words. I sat down for the first time to write about it and ended up with 9,000, so I had to do some editing. But I found that very therapeutic. And even to this day, every year or two, I'll go back and read that chapter and remember where I was 3 years out from diagnosis. I think a lot of people find it cathartic to write down things as they go along, whether they're good or bad. I think sometimes too, it helps communicate with other family members and loved ones. Instead, if you create a web page and are putting it out there, where, you're not necessarily having to repeat the same things 15 times on 15 different phone calls. So I think there certainly is utility to it.
I think I know the answer to this question, but I'm going to ask anyway because I still want to hear your answer. If you had a do-over, if you could hit the rewind button back to the day when you first discovered that lump, and if you had another chance to do anything differently going forward, would you have done anything differently? And if so, what?
Yeah, well, certainly I would have gone to the doctor immediately. 7 months of living like you're dying sounds like a great time, but it's mentally, it's very challenging and emotionally. Granted, I had a lot of fun doing what I was doing, but I rather would have gone to the doctor and then did it. I think that's probably the biggest part. I certainly would never trade my diagnosis. I don't know what my life would have been like before the diagnosis, but I certainly love the one I have after. So.
Mike, we have learned on this show by talking to people with different types of cancer that with different types of cancer, there are different amounts, different levels of support avenues. I am a survivor of prostate cancer. There are all sorts of support avenues for me. There are those with quote unquote rare cancers who have little or nothing by way of support avenues simply because their type of cancer is so obscure. The medical community doesn't know a whole lot about it. And things just have not evolved to the point that there's much in the way of support for those with rare cancers. I'm guessing that testicular cancer would fall somewhere in the middle. It's not a rare cancer, but it doesn't have the high profile of prostate cancer or breast cancer. Was there a time after you were diagnosed that you looked for a support avenue of your own? And if so, what did you find?
I did. I remember receiving literature from the Cancer Center talking about support groups and this and that, and I kind of laughed it off. I got a brochure on self-esteem too, and I'm like, I don't need this. I'm fine. But what I did is I kind of secretly developed my own support group. So back when there were actually people on the website called MySpace, I would search around for testicular cancer, and if someone mentioned that they had it, I reached out to them, mainly at the beginning to try to figure out what my treatment options were and what I should choose and what they chose. Outside of that, there weren't very many resources available. There was a listserv, there was a forum, but otherwise far and in between. And even to this day, it's almost impossible for us to have in-person support groups, just not enough guys diagnosed in a geographical area in the same kind of time period to get them together. I think there's one I'm aware of in London that's doing a great job, but it's typically a younger man's disease. It can happen at any age. And so, trying to round up, 25-year-old guys is like herding cats. So it can be quite difficult, even though I think they would benefit from it. So a lot of the stuff done today is more online, digital, email, phone calls, text, you name it. If you can communicate it, that's what we use to help support those diagnosed.
Our guest is Mike Craycraft of Cincinnati, Ohio. He is a testicular cancer survivor, and he is the founder of the Testicular Cancer Society. That said, Mike, we want to hear about what was the impetus, what inspired you to found the Testicular Cancer Society?
Well, really, at the time of my diagnosis, there wasn't much available for testicular cancer, and what was there, and it was kind of the advent of all the online, uh, billboards and groups and this and that. But you would find one and figure out that only 4 people had been there, and the last one was a year ago. And so there were a couple of good resources, and I thought, well, it was hard for me to find, and with my medical background, I understand the disease fully, and my then being diagnosed, I understood that side of the bed rails. And so I thought, well, what if I create something that's like the hub of a wheel? People can come in, I can show them where they can go, where resources are, I can listen to them and find solutions to problems that they had that resources weren't available. So that really was the impetus. In short, was trying to make the world of testicular cancer a little bit better than it was when I got there.
I'm going to ask this question of you a second time, but this is the first time I'm going to ask. And that is, if somebody wants to go to the Testicular Cancer Society's website, what is its address?
Yeah, it's just testicularcancersociety.org.
With that in mind, I want to hear more about what TCS can do for people. So I'm sure that in the years that TCS has evolved, that it has grown in scope. What are some of the things that you could do in the early days of TCS, and what are some of the things that you can do now?
I think in the early days is more pointing people in the right direction and, trying to support them along their way, almost more from, an emotional support type situation. At this point, I've spent so many years studying testicular cancer that I think from more of a clinical navigation perspective, I help a lot of people individually one-on-one going through their care. What's the next step going to be? What does that piece of information mean? You only get so much time in the doctor's office, and you come out with so many questions, and you can read a whole bunch on the web, but no one really answers your individual question, even if that same answer was on the web page. So that's really what we're doing more now than we were probably at the beginning. We're more effective at it. It's constantly evolving. So
what are some of the things that are part of your vision for the future for TCS?
Well, so we work in 3 main silos, increasing awareness, access to care, and quality of care. So really working on the quality of care issue. The guys are diagnosed all across the US. Not every medical center has a lot of expertise with the particular cancer. There's less than 20 that see 20 or more new testicular cancer patients a year. We see 500 to 700. It's not unusual that when you see things a whole bunch, or you do things a whole bunch, you might have a little more nuance to it than if you see someone, a cancer patient once every 5 years. So I think really advancing that quality of care. And the second biggest part is the awareness issue is still such an issue. It's difficult to raise awareness, to get the message to stick. But really, I'm a perfect example, although I didn't go in early, but I was still diagnosed at early stage, that I could get by with 45 minutes of surgery and follow-up, where other guys are facing, 9 to 12 weeks of chemotherapy and even more robust surgeries after that. And, you're losing 6 months of your life and coming out with a whole bunch of financial toxicity.
You had mentioned, Mike, minutes ago, that when you were diagnosed, you encountered a scarcity of opportunities for face-to-face counsel or face-to-face care from a healthcare professional. Here we are communicating via Zoom. To what degree is Zoom in the toolbox for TCS?
It is. I mean, we really, when we're helping someone, we rely on their preference of how to communicate. It's Zoom's a lot easier for me, or a phone call, but the person diagnosed or the caregiver that we're helping at the time that might not be their thing. So we do text, email, WhatsApp. I mean, literally Instagram direct messages. If you would list the ways we communicate now and gave it to me 10 years ago, I would have laughed and said, you're crazy. No, just call. But it's really meeting the needs of those affected.
One more time, what is that web address if somebody has heard what you've had to say and they want to contact the Testicular Cancer Society?
Yeah, so it's just testicularcancersociety.org.
All right, we're going to bring this to a conclusion now, Mike. And while we begin our interviews from the same place, we like to end from the same place. And that is that if you, and I'm sure what I'm about to mention, this does come up from time to time, but if you encounter somebody who has just been diagnosed with testicular cancer, or they're waiting to find out if they'll get diagnosed with testicular cancer, if you had a private audience with them one-on-one, via Zoom, over the phone, on the street, face-to-face, whatever, your message might have numerous facets to it. But if there was one facet that was more important than all others, one thing you really want to drive home to that person, what would it be?
Really is to take a deep breath, take a step back and get some perspective. And I think that is the best place to start off with. We all have our own experiences with cancer as we grow up. Testicular cancer is very unique. It's unique as every other cancer. And so our previous experiences aren't necessarily the reality sometimes. And so I think taking a moment to get perspective of what's going on is really important. It will help down the road. And certainly that's what we're here to do to help as well.
Mike Craycraft of Cincinnati, Ohio. He is a testicular cancer survivor, and he's the founder of the Testicular Cancer Society, and he's been our guest. Mike, thank you very much for a story that has been informative. And I hope to people who are listening who may be diagnosed, I hope they will find it inspirational as well. Mike, again, thanks so much for being with us.
Thank you for having me, and thanks for watching and listening.
And that'll do it for this episode of Cancer Interviews. We want to remind you that if you are in a cancer journey, or if you are the loved one of someone who is, anyone who is, they're not alone. There are all sorts of people out there just like Mike who are there to help you. And when they speak, make sure you listen. So that'll do it for this time. And until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.